Hey guys, hi, welcome to Unacademy. This channel is Unacademy Future Doctors, and I am your educator for biochemistry, Dr. Shivangi Shukla. Hi, good evening, welcome everyone to today's session. Let me just check if the live stream has started or not. I'll just check if the live stream has started. Do let me know if my video and audio, both of them, are clear. Am I clearly audible to everyone? My video clear to everyone? Do let me know, guys, if the live stream has started. Just let me check once. All right. So today we shall be having an MCQ based discussion. That is, we'll be practicing MCQs and we'll be reading the theory behind it. Okay. So I'm Dr. Shivangi Shukla, as most of you have been together for the past 6 months now. Okay. Now, about the, I'll just quickly brief you about the NEET PG subscription that is available on the Unacademy app. Both Plus as well as Iconic subscriptions are available, and both of them will give you access to video lectures from top educators across the country. Also, in addition to the video lectures, you can get their PDF notes, the printed PDF notes of the educators, timely periodic quizzes, all India combats, using state-of-the-art tools like raise your hand feature, polls, so as to simulate the physical classroom environment. And the USP of both of these subscriptions is that you can access these while on the go on any device of your choice. Okay, be it your laptop, your tablet, your phone, or even your PC at the comfort of your home. Okay, all right. So also the Iconic subscription will give you access to resources from Prep Ladder as well. All right. So depending upon your needs, you can use any of these two subscriptions. All right. Okay. Now, also one very important announcement that between the March 16th to May 16th, Unacademy is running a rapid revision course for revision, especially for NEET PG examination for this year, 2022. That is in May. Okay, so here there'll be a exhaustive yet rapid revision of all the 19 subjects in medicine. Alright, so do consider this. Also, do not forget to put in the educator code DRSHUKLA Dr. Shukla while taking the subscription, the Plus or Iconic. Okay, DRSHUKLA Dr. Shukla. Alright, it is going to fetch you an additional 10% discount. Alright, guys. So, let us start with the MCQs. For each MCQ, I'm going to give you 4 minutes. 4 minutes to answer in the comment section. Okay, if I'm not getting answers, I'm going to reduce the time for answering to 2 minutes. Okay, so 4 minutes for each MCQ, and then after that, I'm going to tell you the answer and then we'll discuss. Okay, alright, so do let me know the answers in the comment section. The first question. Substrate level phosphorylation during the TCA cycle involves which enzyme? Is it A. Succinate thiokinase, B. Isocitrate dehydrogenase, C. Malate dehydrogenase, or D. Fumarase? Alright, now do let me know. Your time has started. Let me know the answer in the comment section. Come on, everyone. Come on, last 2 minutes left for you to answer. Come on, guys, do let me know. What do you think about this? What should be the answer? Last 1 minute left for you to answer. Substrate level phosphorylation during the TCA cycle involves which enzyme? Is it A. Succinate thiokinase, B. Isocitrate dehydrogenase, C. Malate dehydrogenase, or D. Fumarase? Come on, you can answer in the comment section. Okay, so the correct answer here is A. Succinate thiokinase. Okay, now this enzyme, what is this enzyme? It is also known as succinyl CoA synthetase. Now look at the enzyme name, succinyl CoA synthetase. That means it is used in the synthesis of succinyl CoA. And because it is a synthetase, that means it is going to require ATP, isn't it? This is how it is. Now look at this. What is this? This is the Krebs cycle, isn't it? Now in the Krebs cycle, it is this step that we have to focus on. Can you see the first characteristic that you should look at is that it is reversible. It is a reversible reaction. Therefore, it is the same enzyme which is going to catalyze the conversion of succinyl CoA to succinate and vice versa. That is succinate to succinyl CoA. Okay. So, this succinyl CoA utilizes ATP to convert to succinate, and succinate is going to give off the energy. Succinate is at a higher energy level. So, it is going to give off the energy to produce succinyl CoA. Okay, and the enzyme involved here is succinate thiokinase or succinyl CoA synthetase. It can be called by any name. Okay, so this takes part in the Krebs cycle. Very, very important to note the steps which are irreversible in the Krebs cycle. These steps are irreversible. It is very important. The rest, all the steps as you can see are reversible. Similarly, I made you look at glycolysis also, the reversible as well as the irreversible steps. So please take note. Okay. Second, which of the following is not involved in ketogenesis? It is a relatively easier question, so I'll give you just 2 minutes for this. A. HMG CoA synthase, B. HMG CoA lyase, C. Mitochondria, or D. HMG CoA reductase. Which of the following is not involved in ketogenesis? Okay, your time starts now. Come on, answer. Answer in the comments section. Come on, everyone. Everyone should answer. Hi, med student. Med student has answered with a D, that is HMG-CoA reductase. Okay. Is there anyone who wants to contend this? Is there anyone who wants to contest this and say and give some other answer, or are you satisfied with this answer? Come on, last 1 minute left for you to answer, guys. Last 1 minute left. Everyone should answer. Last 30 seconds left. Come on, come on. Hi, Sanchita. Hi, good evening. To answer this, last 10 seconds left for you to answer. Which of the following is not involved in ketogenesis? A. HMG-CoA synthase, B. HMG-CoA lyase, C. Mitochondria, or D. HMG-CoA reductase? Alright. So the correct answer, as very correctly given by both med student and Sanchayata, is HMG-CoA reductase. Very good, guys. Now, we have to compare and contrast ketogenesis and cholesterol synthesis. Very, very important. That is what we have done every time we have studied, okay? Ketogenesis and cholesterol synthesis. Now, ketogenesis occurs where it occurs in the mitochondria. Okay, the first step of distinction is it occurs in the mitochondria, whereas cholesterol synthesis occurs where it occurs extra mitochondrially, that is in the membranes of the endoplasmic reticulum and the surrounding cytoplasm. Okay, now HMG-CoA synthase is the common enzyme in both. Okay, it is present in both. HMG-CoA synthase is present in both. So acetoacetyl-CoA plus one molecule of acetyl-CoA will combine using the enzyme HMG-CoA synthase to produce HMG-CoA. Now this HMG-CoA can be acted upon by either HMG-CoA lyase to produce acetoacetate in ketogenesis inside the mitochondria, or this HMG-CoA can be acted upon by HMG-CoA reductase to produce what? Can I know in the comment section? HMG-CoA reductase acts upon HMG-CoA to produce what? What is the product? Can anyone let me know in the comment section? HMG-CoA when acted upon by HMG-CoA reductase produces what in the cholesterol cycle? Mevalonate. It is the first step in cholesterol synthesis and it is the committed step, rate limiting step. So this HMG-CoA reductase is involved in cholesterol synthesis rather than ketogenesis. Extremely important for you to know. Okay. Alright, mevalonate. Yes, it produces mevalonate. Not acetoacetate, Sanchayata. Acetoacetate acetoacetate is produced from HMG-CoA lyase. Okay. And because acetoacetate is what? It is the first ketone body to form. And the most predominant ketone body to be formed is beta hydroxybutyrate. Okay, it is formed from the dehydrogenase, beta hydroxybutyrate dehydrogenase enzyme, which acts on acetoacetate. Okay, so lyase will act upon HMG-CoA to produce acetoacetate and reductase will act on HMG-CoA to produce mevalonate. Okay, next. You need not be sorry. I'm happy that you are answering. Okay, so answering, the main focus should be to answer, because you are learning from your mistakes here. Okay, there is scope for learning here. There will be no scope for learning in the final exam. You should make mistakes here. Do not make mistakes in the final exam. I'm very happy that you are attempting the answers. It is very good. Congratulations. Next. Which of the following is involved in catalyzing the conversion of aldose sugars to ketose sugars? A. Phosphotriose isomerase, B. Decarboxylase, C. Oxidoreductase, or D. Hexokinase. Okay, your time starts now. Come on, 2 minutes for you to answer. Come on, guys. 1 minute is almost over. Just last 1 minute left. Okay, med student is saying oxidoreductase. Sanchayata is asking, I've joined medical college last month. If you could kindly tell me if there's any regular batch going on here which I should follow. Hey Sanchayata, regular here what is there is on YouTube as well as in special classes, we take up important topics. Okay, and MCQ discussions, strategy topics, motivational sessions, and all the important topics on which long questions or short questions are asked. We take topic by topic. But detailed batches are available only through subscription on the Unacademy app. Okay, either plus or iconic subscription if you wish to take regular batches, regular classes. Here, these classes are more of revision classes as well as any doubt solving classes plus any important concepts if you want to be cleared. Okay, so we take up important concepts, newer developments, all these things which are not there in the book. That also we take up here. Okay, so I think, yeah, the time is up now. The correct answer here is A. Phosphotriose isomerase. Okay, now if you would know the nomenclature, aldose means aldehyde and ose means monosaccharide. So it is a monosaccharide containing aldehyde as the functional group. Can you give me an example? Example of a monosaccharide with aldehyde as the functional group. What is this? Any example? Very, very common. And this one is ketose. That means it is ose is a monosaccharide with ketone as the functional group. Now what is this one? Both of these are very, very common. This is glucose. And this one is fructose. Both are isomers of each other, same molecular formula, but fructose contains a ketone group, glucose contains an aldehyde group, and they can interconvert using the enzyme phosphotriose isomerase. Okay, similarly, this is DHAP, that is, phosphohexose isomerase, not triose. So this one is phosphohexose isomerase because these are hexoses, they are six carbons. Similarly, there are two very important compounds that contain 3 carbons, and they are also ketone and aldehyde. They are, the ketone part is DHAP, that is dihydroxyacetone phosphate. Acetone is a ketone. This also contains 3 carbons. And glyceraldehyde 3-phosphate. Glyceraldehyde, aldehyde 3-phosphate. Now, both of these can freely interconvert with each other using the enzyme phosphotriose. Triose means 3-carbon sugar. Phosphotriose isomerase. Now, glucose 6-phosphate and fructose 6-phosphate can freely interconvert using the enzyme phosphohexose isomerase. Now, you're understanding how the enzymes are named. Okay. Yes, very good, med student. There seems to be a lag between the time that I ask the question and the time that you give the answer. That is because the live stream plays at a lag of about a few seconds. So it's okay. Alright. So glucose 6-phosphate converts to fructose 6-phosphate using phosphohexose isomerase, and DHAP converts to glyceraldehyde 3-phosphate using phosphotriose isomerase. So in short, the enzyme is isomerase. Triose is for the 3-carbon, hexose is for the 6-carbon compound. Phospho is for, there is the phosphate group also present in this compound. Understood? Next question. So for this oxidoreductase, med student, you had this doubt. Oxidoreductase enzymes, they cause oxidation reduction reactions like dehydrogenase enzyme. Remember, dehydrogenase enzyme will remove hydrogen from one compound and add hydrogen to the other compound. So the compound from which hydrogen has been removed has been oxidized, and the compound on which to which hydrogen has been added has been reduced. So this dehydrogenase enzyme or oxidase enzyme, these enzymes are oxidoreductases. They cause oxidation reduction reactions. Next, which among the following is or are a marker for myocardial infarction? Very, very important. Your 2 minutes start now. Is it A, LDH, B, CKMB, C, troponin I, or D, all of the above? Your 2 minutes start now. Okay, med student is very quick to answer. Come on, look at the question, look at the options. A, LDH, B, CKMB, C, troponin I, or D, all of the above. Which of the following is or are a marker for myocardial infarction? Last 20 seconds left. Hey, okay, med student. So you've just passed your first year and you're reading majority of the leftover topics. Very good, very good. This is commendable. Very good, very good. So both Sanchayata and med student have marked D as the answer. I'm impressed, med student. This is what you should do. So in your second year, what my advice to you is that you should focus on building the basics of your second year. And what are the 2 important subjects that are you would already be knowing? Pathology and pharmacology. So focus on building the basics of pathology and pharmacology, and at the same time do not lose touch with the first year subjects. And how can you do that? Exactly by how you're doing. You should just watch some videos or lectures at 2x speed if you don't have much time. But what you can do is you can watch videos and lectures, and you can wherever you're getting stuck, you can go back and revise your notes. Okay, for anatomy, physiology, and biochemistry, and also keep on solving MCQs through these MCQ discussions. I'm also taking MCQ classes on special classes on Unacademy. So tonight at 11 p.m. also I'll be coming up with an MCQ discussion there on the Unacademy app. So you can attend that also. Wherever you are getting bored, you can attend that. And it does not take much of your time also. In between, whenever I give time for people to answer, I usually give a lot of time for people to answer so that there is maximum participation. Okay, and people can think through. People do not just go on and punch in the answer. Rather, they can revise the whole of the topic before punching in the answer. So during the time when I give the answer, give the time for people to answer, during that time you can maybe revise the topic, or maybe you can chat with your friends or whatever, and whenever the next question comes in, you can quickly punch in your answer and then keep on doing whatever you were doing, and during the discussion you can attend the discussion. Okay, so I really agree with you. I'm impressed with your method of revising the first year. Very good. Okay, so the correct answer, the time is up. I think the correct answer here is the correct answer here is all of the above. This is lactate dehydrogenase, this is troponin I. Now all of these are markers of myocardial infarction. Whenever there is any insult to the myocardial muscle, then these are the enzymes that are released. Okay, now the reason why I asked this is to tell you about isoenzymes. Okay, now what are isoenzymes? Isoenzymes are those enzymes which are different forms of the same enzyme occurring in different tissues and catalyzing different reactions. Okay, so the same enzyme, creatinine kinase is a kinase. What is it? Kinase. Kinases are transferases. They transfer phosphate group from one molecule to the other. The same enzyme, creatinine kinase, can be present in 3 different tissues. The tissues are brain, muscle, and heart. When it is present in the brain, it is called CKBB. When it is present in the muscle, it is called CKMM. And when it is present in the heart, it is called CKMB. And whenever the heart muscle or the myocardium is insulted, or it undergoes some kind of injury or death, then this is the enzyme that is released in a large amount, CKMB. Okay, to check for any insult to the brain, then what will you check? Which isoenzyme? CKBB. Whenever there is some kind of an inflammatory viral reactions, okay, then what happens is there can be large elevation of CK, creatine kinase. Okay, so now you have to check for the isoenzyme that is elevated. It can either be CKMB, CKMM, or CKBB. Now, if CKMM is elevated, it points towards some kind of an insult to the muscle. Okay, it can either be due to trauma, cases like rhabdomyolysis, which are post-traumatic destruction of muscles, and the muscles are the muscle proteins are excreted in the urine in large amounts, causing acute kidney injury to the kidney tubules. Okay, so in rhabdomyolysis also CKMM can be raised, or post-viral inflammatory phase also CKMM can be raised. Okay, so this is the main reason why I put up this question, to tell you about isoenzymes. Different forms of the same enzyme present in different tissues, catalyzing different functions. Okay, next one. All of the following are hexoses except hexoses. Now I have mentioned about this in the last question, so I hope you get this one correct. I'll give you just 1 minute for this. A. Glucose, B. Galactose, C. Mannose, or D. Ribose. All of the following are hexoses except Okay, Sanchayata has answered D, ribose. Now with this, I want you to differentiate between hexose and, okay, hexose, pentose, triose, all this you would know, right? Okay, med student has also answered with ribose. Alright, so the correct answer, as all of you have mentioned, is, it is ribose only. Why? Because ribose is a pentose. What is a pentose? Pentose is a 5-carbon monosaccharide. Mannose is a mannose is a 6-carbon monosaccharide. Okay. Now, what is the similarity between mannose and galactose and glucose? All these three are, glucose and galactose are epimers. Glucose and mannose are also epimers. Now, with this, I want you guys to tell me what epimers are. This is your homework. You guys should tell me what are epimers. Okay, I want to know what epimers are. Also, riboses, where are they synthesized? In which cycle is, we have read where ribose is synthesized, in which cycle? So there are two questions. What are epimers and where have you read about synthesis of ribose? In which important cycle, in which important pathway have you heard about the synthesis of ribose? Okay, riboses are used in nucleic acid synthesis, ribose sugars. So where have you heard of synthesis of ribose, which is one important pathway that leads to an intermediate, a useful intermediate, that is ribose. And the second question is, what are epimers? Okay, so this is your homework for today. Now I'm going to conclude because I have another session, a motivational session on healthy competition. After 10, it is going to start in 10 minutes. Okay, so I'm going to stop the stream right now. If there's any doubt, you can ask me in the next session. That starts at 6:45. That is on healthy competition. Okay, how tips to develop skills for healthy competition, which is very, very important. Okay, guys, then see you in the next session. And med student has already answered the first question. Now I want the answer for the second question, that is, what are what are epimers? Okay. All right, then see you. You can answer in the comment section and we'll discuss in the next session. Okay, these MCQ sessions are going to be a daily affair now. Tomorrow also, day after tomorrow also, throughout this month of March, I'm going to take daily MCQs here on YouTube and on the Unacademy app. So please do stay tuned to these, and they'll be a good way to revise your syllabus. Okay, and also for those who have just entered MBBS, their first year, like Sanchayata, you guys can have a fair idea of what are the important topics. Okay, when you look at these MCQs and the small discussion that we have over the related topics, then you guys can have a fair idea of what are the important topics you have to focus on throughout your first year. Okay, then see you guys. Bye bye. Take care. See you in the next session.